Welcome back to Midterm 1, and today we're going to talk about some bone problems and conditions, give you a little idea about some things that may happen in bone. We've laid a groundwork in regard to vocabulary and word roots and prefixes and suffixes and, lumps and bumps on bone and the configuration of bone. But let's talk about some conditions just for the fun of it, okay? So what does all this mean that we've led up to this? Well, there's a number of words that are down here, and we're going to go over most of these, if not all of those, in some way, shape, or form. Okay, we'll talk a little bit about, and Ewing sarcoma is a cancer associated with an osteogenic sarcoma. There's a bunch of different types of sarcoma, and because as a medical word, it ends in OMA, and OMA usually means a tumor. We'll talk about exostosis. And exostosis is just another name for a spur. Somebody has a bone spur, it's called an exostosis. It sounds more impressive, and maybe they could build more. I don't know what the case may be, but it sounds more impressive. And then we'll spend some time talking about fractures, closed fractures, open or compound fractures, combinuted fractures, pathological fractures, green stick fractures, compression fractures, impacted fractures, and then we'll mention something called ORIF. ORIF stands for open reduction and internal fixation. That's when they start to put screws and plates and bones. And a word that we don't have is down here is crepitus. And crepitus is something that we sometimes feel when somebody has a fracture. What will happen is when the fracture fragments move. In other words, we'll have ends of bone, and when the fracture fragments move against each other, they sort of grind. Okay, and that grinding that they get when you move a fracture fragment, okay, is called crepitus. So sometimes with a fracture, you'll feel that crunching or grinding. And it's just a sharp edge of bone that's been broken and moving against another bone. So I don't have a picture for that, but that's what crepitus is. Okay, it's something that's non-commonly seen in certain types of fractures. So let's talk about these things. Let's talk about the real stuff again. Osteogenic sarcoma, which will actually link with Ewing sarcoma, osteomyelitis, and osteoporosis. These are two big things. We'll show you some of that. We'll talk about osteomyelitis a little bit. Just a little bit. I'll show you some x-rays of osteomyelitis. And talpes. Talpes is a word that actually means clubfoot. Clubfoot. And I'll show you the most common type of clubfoot. There's multiple different varieties, and the one that we usually see is what's called talpes, called Equinovaris, which equino means the foot's angled down, and varus means it's turned inwards, okay? And that's what those two words mean. We don't really have those words so much in our vocabulary so far, but that's what they mean. Equino means the toes are pointed downwards, and then the plantar aspect of the foot is turned inward with the varus deformity. So let's look at some pictures. Have some fun here. Now, this right here is an osteogenic sarcoma. An osteogenic sarcoma is just a tumor, okay? An osteo, and what osteo means is bone. Genic means forming, and sarc means skeletal muscle, and oma means tumor, okay? But basically what we see here is this is a femur right here. You can actually see all this disorganized bone in there, and that's an osteogenic sarcoma. These are usually treated with amputation, chemotherapy, and stuff like that. It turns out a lot of these what are called primary bone cancers. It gives me to a good point. Sometimes we have what's called primary, okay? Primary cancer, and we have what's called a secondary cancer. Primary means that the cancer started in that area. It started in the bone, okay? And that's osteogenic sarcoma or Ewing sarcoma. I'll show you a picture of Ewing sarcoma after this. That means it starts in the bone. Secondary cancer means the cancer actually started in some other organ somewhere else and actually did something called metastasize, which means it spreads to bone, okay? And so as a result, because the cancer is from somewhere else and it goes to bone, it's called a secondary cancer. And the word metastasize is a good medical terminology word, which means that cancer has spread from one area to another, okay? I wouldn't expect you to be able to recognize an x-ray like this, but this is just what's called a Ewing sarcoma, which is basically a cancer, one type of cancer. And this is another one. This one's called Ewing sarcoma, okay, as compared to the osteogenic. The thing is interesting, and the reason why I brought this up, and I probably wouldn't even brought either of them up, but if we look at the bone, you can actually see the bone right here, okay, and you can see the cortical bone right here. Okay, here's cortical bone right here, and this is that medullary cavity or medullary canal that goes through the bone. And you can see how it's widened here. But the thing that I really wanted to point out here that I think is interesting is this thing right here and this thing right here. See this hump right that comes up like that? There's a hump that comes up like that. Okay, that is actually what we know and love called the periosteum. We talked about that. That's that membrane that covers the bone that has the potential to form bone, okay? And the thing that's classic about a Ewing sarcoma is when they look at this it's called a periosteal reaction. And they have a word where they have something like this. But if you look at the periosteal reaction, it looks like hair on end, like that. You see little lines there in there. See how these look like little wispy lines going that way? And that's very classic for Ewing sarcoma. Okay, and that's just, but I want to bring this up because that's the periosteum. It's a periosteal reaction in response to the cancer. Okay, and that's very classic as to what it sees. So that's actually starting to see, you see a little periosteum right over here as well. Now, this is Nexus Ptosis. I said Exostosis equals spur, okay? And this is the heel bone. This is the calcaneus right here. The calcaneus. This is all the also the calcaneus, the heel bone. The Achilles tendon would be coming up in here, and there's a band of the bound foot called the plantar fascia that comes right there. If we look right there, there's a spur. This is called a plantar spur because it's on the bottom, okay? And if I erase this line right here, again, the Achilles tendon is going to be coming down right here. This is what's called a retro. This is a good word. Retro calcaneal exostosis. Retro means behind or backwards, okay? So it's in the back of the heel, right where the Achilles, it's actually embedded within the Achilles tendon. Retro calcaneal, because this is the calcaneus, exostosis because it's a spur. Okay, so that's just a spur. So if you see the word exostosis somewhere, it means spur. It's not uncommon. You see, and it's not just on the heel that you'll find these, but you'll find them in multiple other bones. A lot of times because of osteoarthritis. A lot of times in the case of osteoarthritis where the joint's worn down, we'll get a little spur right at the edge of the joint, try to stabilize the joint. It really does, and it causes more problems, really. Now, what I want, this is going to be fun right here. Let's talk a little about fracture. And a fracture is a break in a bone. Is a break in a bone where the bone's lost its continuity. Now, if I look at this fracture right here, everybody says, well, look at that fracture right here underneath number 1, and the answer to that is wrong. That's actually the growth plate. So if you look right here, that's what the growth plate looks like. You see a growth plate there, you see the growth plate there. However, there is a fracture here. That fracture is 2. If you look at that line, if you look at this area right here, look in this area right here. See, it looks like a very faint crack. It goes across the bone. Sometimes they're very difficult to see. However, if you look over here, here's the cortex comes here, and here's the cortex comes like that. And you can actually see right there where that crack started at the edge, okay? So that's a very subtle one. It's in a kid, obviously, because we do see growth plates, and growth plates are closed in adults. But that's what we see in a fracture that it's very close to the growth plate. Again, this would be the radius, because everybody knows that, and therefore this is the ulna. The ulna. Now over here, this is really easy to see. You know, you don't have to even open your eyes to see this one. This one right here, you can see the fracture that comes right through here like this. And this is called a spiral oblique fracture. So if you ever see the word spiral oblique, it's like that. And the reason why it's a spiral oblique, because first of all, it's not across the bone, which would be transverse, but it's oblique. But actually when the bone actually has a twist to it, and that twist allows that fracture to sort of rotate a little bit around, okay? So it's spiraling around the bone. And this is the humerus, okay? Which is, you probably should have known, this would be the elbow down here. Here's the ulna again. The radius would be in here. Okay, let me get rid of myself there. Here's the radius over here, and the ulna would be right here. But basically, this is sort of like what we call the diaphyseal, because again, we know that middle portion of the bone, the shaft is called the diaphysis. That's a diaphyseal spiral oblique fracture of the humerus. Okay, that's pretty easy to see. Let me just erase that so you can actually see that pretty well. You can see how sort of that fracture sort of rotates around the bone. It's not, you know, a straight line, it sort of rotates around. So that's called a spiral oblique fracture. We have a bunch of different types of fractures, and what I did is I put this slide on here just to try to explain some of these different types of fractures, or nomenclature, some medical terminology for it. I won't really test you on it too much. This is what the normal bone would be looking like, something like this. And this is called a transverse fracture right here. Why? Because it's across the bone this way. This area is called an oblique fracture because it's oblique, and this is called that spiral oblique because what happens, it's oblique but sort of rotated around. In other words, that the fracture, instead of being a straight line, this sort of like rotates around the bone a little bit. Okay, this one right here is called combinuted. Now I'll show you some an X-ray of a combinuted fracture. Combinuted means many pieces. Okay, Which does actually have to be many. If I have more than two pieces, 1 and 2, and I have a lot of little fragments in there, that's called combinuted, okay? Now, the next one right here is a really interesting one. It's called an avulsion fracture. You can see you can see the fracture sitting right here, and what happens is there's something that's attached to your muscle ligament that will pull that piece off. And when it's pulled off, it's called avulsed. Avulsed means pull a chunk off, okay? And that's what an avulsion fracture is. So if you see an avulsion fracture, a chunk's been pulled off. That's not common, like in the area of the outside of the foot by the 5th metatarsal. And a couple other areas they're not uncommon to have avulsion fractures. This one right here is called impacted. Impacted means if I have one piece of the fragment right here and one piece, this one's driven down this way, this one's driven down this, and they sort of all bunch up right there. It gets jammed together. And because it's jammed together or impacted, it's called an impaction fracture. Okay, impaction. A fissure, that's just a crack in there that you can't see that's longitudinal. It's not usually very common. This one right here, I'll show you an evidence x-ray of this. It's called a green stick fracture. And this occurs in kids, okay? And what happens is their bone is a little bit more bendable than adults. And it's sort of like if I take a stick and I try to bend it, okay, and that stick just fell, like a twig fell out of the tree, I'll bend it. And as I bend it, part up here at the top is going to crack, it's going to fragment, but the bottom here gets pushed together and it doesn't break. It's like in a, quote, green stick. In other words, a green stick that's not totally dry. Okay, if you look at the wood in that twig that fell, it's sort of green, you know, it's not really totally dry, it's still moist. So as a result, what happens, that's what sometimes happens in kids. They get a green stick fracture. This side of the bone's okay, but the bone are fragments because the bone's being bent this way. And this part up on the part on the convex area is getting pulled apart, or the part in the concave area is getting pushed together. Okay, so that's that. Here's another spiral fracture, oblique fracture, transverse fracture. Here's that combinuted fracture, a little bit bigger. This is called displaced, okay? And this is an important word. Here's an impacted fracture, wedge fracture. These, I'll get to that. This is called a displaced fracture, okay? And a displaced fracture means that what happens is this part and this part, which should be against each other, aren't. If it's out of place, therefore it's called displaced, almost like a misplaced, but displaced. This area should be up on top of here, and it's not. And that's called displaced fracture. This one, they had the fracture set, okay? In medicine, they don't really say, let's go set the fracture. The word for setting a fracture, medically, okay, is called reduce. Reduce. Let's reduce that fracture. It's called reduction. Reduction with the process of reducing or putting a fracture back in its normal position. So this is displaced because they're not aligned, okay? This right here, I go to this wedge fracture here, and basically you see this right here? Sometimes they have a special name for that little fragment, and they call it a butterfly. Butterfly, that should be an E, butterfly fragment. Okay, it sort of looks like a butterfly, and that's what we see in that little wedge right there. Now, the last one I have down here is called an open or a compound fracture. If you see a compound fracture, it may be combinuted, but compound or an open, compound and open both are appropriate medical terms, and what they mean is there's a wound to the outside. Okay, part of that fracture fragment, if this is the skin, part of the fracture fragment actually penetrated from the inside out and made a wound or a hole right where that fracture would come out. And I've seen some really nasty fractures where you look and you see the bone, you know, a big piece of bone sticking out, you know, from the skin, which is not normal, obviously. So we'll show you some pictures of some of these. Now this right here is a combinuted fracture. This is a hip, okay? So this is a femur, okay, which we probably know. It's a femur. And if you look down here, I can't even count the number of pieces. 1, 2, 3, 4, 5, 6, 7, 8, probably 9 or 10. There's probably 9 or 10 or 12 pieces there. So they try to get the bone straight. And actually, pretty easy. What they do with this is most of these smaller fragments, what will happen is when the bones start to heal, the osteoclast, now we know what osteoclast is, it resorbs bone, takes bone away, will come in and you know, mostly dissolve those. What they actually do is they run a rod right down through here. They actually take a rod, okay, and drive it up. They pull the bone out this way. They drive the rod up through the hip and out a hole up here. Then they move this part over to here where it should be and line up the bone here. So this area right here is going to be lined up here. And let me do a different color. This area is going to be lining up here. and this area is going to line up here, and they get the bone end on end, and that rod is sticking out the skin at the hip. Once they get it there, then they pound it back in. They pound it down this way, and this rod then goes right across where the fracture is and holds the fracture in a nice place. Okay, that's called it. And the reason why I mentioned that is that would be called an this is a good term, medullary rod. Now you should be able to figure that out. Inter means inside, okay? Medullary means that medullary cavity, which is a term that we had in the previous video, or one of the previous videos. So that would be a combinuted fracture. This is a compound fracture, and this is going through the skin. Now you don't see bone right there. You just see an area, a wound. But if there's a fracture there, you have to almost assume that the bone actually came back in and slipped back out. Now this one right here, this is obviously the foot. You can actually see the large portion of the tibia sticking out through a big hole on the ankle right there. So that's, you see those. You'll see those every so often. So that's just that. It's called a compound fracture. And a compound fracture, or an open fracture, means that there's an opening to the outside. The problem with these is now bacteria can get inside there, and these have to have a higher association with infection because the bacteria get in there and start to grow to create infection around the bone. So these people are usually on some type of IV antibiotics for a period of time after the fracture's been reduced, because now we know what the word reduced means, and they're put on this IV antibiotic just to prevent the infection from occurring. They have to go in, clean it up. They usually take like a jet washer, like a power washer, squirt that puppy out just to get all the dirt and the debris, because there's usually a lot of dirt and debris that gets jammed up in there. They could actually be pretty nasty at times, but that's called a compound or an open fracture. This is a pathological fracture. Now, a pathological fracture means that the bone didn't break on its own, but this area of the bone doesn't look normal because there's a tumor here. Okay, when the tumor is in the bone, it could either be benign or malignant. It doesn't have to make a difference. And what happens, it causes a weakness and causes the bone to break. So if I look and I erase this up in here, you can actually see that area of the fracture up in here, and there's a couple of parts right there. And that's the fracture because the bone was weakened by the tumor, and small amounts of trauma caused it to break. There's actually a guy who used to pitch for the Cincinnati Reds, I think it's Drebecki, and basically you could probably go to YouTube and find this. He was pitching, this is a number of years ago, he was pitching, and actually they didn't know about it at the time, but he throws a ball and falls to the pitcher's mount and he screams. You could hear him on the video screaming. He's laying there rolling around. When they looked at it, he had a fracture through the upper portion, because this is the humerus right here. Here's the scapula, the shoulder blade coming right here. Clavicle would be up in here. Okay, this is that coracoid process. But anyway, and the chromium, that thing on the top, would be up in here. But he was screaming, and so they took him and got x-rays and found out that he had a fracture in his proximal humerus. Everybody knows what the word proximal is, because it broke through a bone tumor. When they looked at the bone tumor, it turned out the bone tumor was cancer, so they went in there, they scraped that all out, they cleaned it out, they gave him a chemotherapy and other things, and lo and behold, guess what? It healed, okay? He tried to make a comeback, come back and he threw a ball, broke it again, and basically they found more tumor in there, and they eventually amputated, took it off, so basically he wasn't pitching anymore after that. So anyway, that's a pathological fracture. The fracture occurs because it's through an area of a tumor. Okay, the bone's weakened by the tumor. This is that green stick fracture we talked about. Okay, and actually this is a kid. Okay, obviously because you don't see the ends of bones. You see how the bone is really still intact right here. Look there, there's a crack right there. The edge of the cortex, or the dense bone on the outside, is cracked right there. And these heal really fast. They heal usually about 4 weeks. They're usually back to normal. Okay, I stick them in a splint. They don't even have to have much immobilization because the bone's still intact. It's just the side. One side of the bone is broken, not all the way through the bone, and that's called a green stick fracture. And they're relatively not uncommon. Let me put it that way, in younger kids. So you will see those stick fractures. Now this is an impacted fracture. Okay, if we look here, this is the radius. Okay, here's the ulna, and here's the carpal bones. We talked about the carpal bones, and what happens is this is actually called a Collis fracture. You can see it from the side. If you look right here, there's an angle like this, and there's angled up this way, and the hand is this way. They actually call this a silver fork deformity, because it's like a fork. If you look like a fork with the tines up in here, here's the shaft of the bone of the fork down here, has that little bend, okay? And they call it silver fork deformity. But anyway, if I look at this fracture, what happens is the edges of the bone up here are real sharp. They're like jagged edges. And what happens, they get jammed in. The bone here gets jammed into here, and this bone gets jammed. So the two bones are getting jammed together, and all these little sharp pieces get stuck together. They sometimes have to disimpact these. And what they actually do, they can do it a couple ways. They usually numb this area up with a little bit of a local anesthetic, and sometimes just pull. And just try to pull it apart, put it back in the right spot, and then impact it again, because when they take those little fragments with little shards and jam them in again, if they have it in the right position, it's going to heal better, okay? Or sometimes what they do is they take the fingers and they put them in what are called finger traps. These little finger traps, they're like little things that grab the fingers, and they suspend it, and then what they do is then they have the arm. I don't have my picture. Let me put my picture up in here. They take the arm this way, and the fingers are in the finger traps up here, and then the arm is like this. Then they put weights here and pull the arm down this way, and very slowly and gradually, they give them usually something to relax the muscles. Usually what happens very slowly, it'll take and move those fragments apart. So instead of those fragments being jammed in like that, okay, they will allow it to disimpact, put it in the right position, and then impact it again so in a better position so it could heal better, okay? So that's just called an impacted fracture. Okay, now this is called the epiphyseal plate fracture. Okay, and these are hard to see. These are sometimes very difficult to determine. Okay, because what happens if we look at these, it looks, you know, this right here looks. This is the ankle. This is the ankle joint right here. This is the tibia right here. This is the fibula right here. And that area right there is not a fracture. That's a growth plate. That's a growth plate. That's a growth plate. You know, what happens is sometimes you'll see a little, you can't see it very well here. You actually see it better down in the x-ray down here. This is the radius right here, and this is the ulna. If you look, here's the growth plate, but there's a little fragment right there at the corner. Okay, let me do it in a different color. Right there, there's a little fragment that sits out there, and that's just the growth plate. The fracture goes through the growth plate and then out that little corner and creates a little spike, and this would be called the metaphysis. This is the epiphysis right here, which we all should know. Okay, and these are not uncommon in kids. They actually heal really well too. They usually heal within about 4 weeks. They heal really fast. Kid falls. I've actually seen some kids who will fall out of a tree and they come in and their hand is actually hanging like 90 degrees to their arm, and all they do is they put it back in the right spot. They numb them up a little bit, put it back in the right spot, stick them in a splint, and 4 weeks later they're ready to fall out of another tree. Okay, but those are epiphyseal plate fractures. Now this is what I talked about. What's called open reduction, or ORIF. Open reduction, ORIF stands for open reduction. Now we know what reduction is, putting it right in the right spot. And internal fixation. Now internal fixation means screws, plates. They could use staples, different types of wires. I mean, they have all kinds of gadgets that they could put in here. And basically, this is the tibia right here. This is the fibula. And then you can actually see where the fracture was right here. You can actually see the fracture line right there. There's a fracture line right there. Oh, actually, the fracture line was across this way. You know, so the fracture line, there might have been a little fracture at that area, and there's definitely one here, but the fracture was here. So what they did is they actually took this part right here, drilled some holes, put these screws in, and then they screwed this part right here into this. And then this right here, because it's really, they could put a screw up there, but they put the plate. So they put plates across, and then what happens is the plate holds the bone straight. They just drill holes in the bone, put the screws in there, and holds it nice and still, Okay, so that's called open reduction and internal fixation, or ORIF. Now, let's talk a little about osteoporosis, okay? Osteoporosis is something that occurs, you know, it's not my osteoporosis. I recently discovered slot machines, okay? Yeah, it's what you see at casinos, so don't waste your time. But anyway, what happens is osteoporosis, this is a normal bone matrix. We talked about that cancellous bone before in our previous discussion, how, you know, we have cortical bone, which is my dense bone, but we have that cancellous bone, and the cancellous bone has all these struts inside there to provide strength. They're like a woven area inside the bone. Well, what happens with osteoporosis, the way these struts are formed, there's bands of collagen, again, like we talked about, and it calcifies along that, or crystallizes. The crystal gets deposited around that. Well, what we find in osteoporosis is calcium we need for is helpful in strong bones, but we need it in other places more. Calcium is much more important in muscle contraction, heart muscle contraction, nerve conduction, clotting, and things like that. Calcium is really important. So if my calcium in the blood levels go down, where's the calcium stored? It's stored in the bone. So what do? They pull the calcium out of the bone and put it in the blood so it can be used for other things that are more important than the bone. Okay. What we find is in elderly females, osteoporosis is a real big problem. And that's because it has to do with something called estrogen. And estrogen in females helps to keep the calcium in the bone, puts the calcium in the bone. And what happens is after menopause, the estrogen levels, whoops, they fall off the face of the earth. And when the estrogen levels fall after menopause, what happens is that there's no need to keep the calcium, or there's no force to keep the calcium in. And so therefore what happens is the bone becomes more porotic. You see all these open spaces right here? And that obviously weakens the bone. So the bone's not nearly as strong. As a result, makes the bone much more susceptible to developing a fracture, okay? And that's the problem with osteoporosis. They give them calcium supplements and stuff like that, but it's really hard to get the calcium back in the bone if it's been taken out, if people have real severe osteoporosis. There's a number of different medications that they have to try to do that. There's one called bisphosphonates, like, Boniva and stuff like that, that basically are trying to get the calcium back in the bone. But again, it takes a long time for that to happen. Okay, so this is what we see sometimes with osteoporosis. If we look, obviously, this is the back, okay, and here's a vertebral body, here's a vertebral body, but look at this one. See how it's wedged down like that? It's a wedge, and we see it more here. And what happens is that created that, remember we talked about kyphosis? Kyphosis is a situation where I have this exaggerated thoracic curvature. And the reason why it's curved is because if you look right there, that vertebrae, instead of being square like that, is wedge shaped, which creates this. And these other ones are starting to collapse as well. The reason why they collapse is because the bone in the vertebral bodies, the big blocks on top of each other, become so weakened because the calcium has been drawn out of it to use in other places, that the bone, which is coughing, sneezing, turning, twisting, having a really difficult bowel movement, whatever the case may be, and straining may just cause enough pressure that will cause these vertebrae to just collapse on themselves. These are called compression fractures. Compression fractures. FX would be a good abbreviation for fracture, as a compression fracture. And it results in this kyphosis. Remember, kyphosis is that big hump that we see in the back. Lordosis is where we get an exaggerated lumbar curve, and then scoliosis is that side to side. But this is that kyphosis, which is in the thoracic region. Okay. Now this one over here is involving the hip, and what you see is there's a fracture right across there. Hip fractures are exceptionally common. Vertebral fractures are exceptionally common. Hip fractures are exceptionally common in elderly females with osteoporosis. Okay, and what happens with this is the path of least resistance is they just go take this part out and they stick a prosthesis in here. Okay, this is just usually a metal implant with a ball, and then they'll reestablish that acetabulum or that socket, and usually put some type of a cup in there. They'll take the ball so that now that it will heal. This one actually has a ball with inside. There's like a ball bearing on the inside with this shaft that right here that will move around inside that ball. Okay, so that's what happens with osteoporosis. The bone has become weakened because the calcium has been extracted for it. Because again, the calcium is needed in other places more than for the bone. The bone, it's nice in bone because it does make the bone strong. But if I need it somewhere else, they're going to take it out of the bone. The body's going to take it out of the bone. Now this is osteomyelitis. Osteo means bone, myelin means bone marrow, and itis means inflammation. And this is more than that. This is actually infection. This area right here, this large black area, okay, is basically a hole. And that hole is filled with something that we know and love called pus. Okay, so for some reason the bone became infected. There's pus there, there's pus there, there's pus there. So when you see these open areas like that, basically what happens is there's been an infection that got inside the bone for one reason, either through the bloodstream or because of a wound or something, and the bacteria go crazy and they just create a large gaps of pus inside there. Very difficult to treat. Takes a long time to treat those with IV antibiotics. They're hard. They're a bear. But you know, and these will sometimes just drain. Sometimes they develop a little like a little sinus tract that will start to drain pus to the outside because the pressure of the pus inside these open spaces gets too high. But that's called osteomyelitis. And so osteomyelitis is basically a bone infection. So if you see that word, that's what it is. It's an infected bone. Okay. Now we talked about clubfoot. Okay, and this is something that this is a newborn right here, and this is that Talpy's Equinovaris. Talpy's means clubfoot because there's like 5 or 6 different varieties of club feet. Okay, but this is the most common, the Equinovaris. And basically what happens is the foot's angled downwards, and you see this, the plantar aspect is angled inwards. These kids, they can be casted at just after birth to try to get the foot, swing the foot back underneath and hold it at 90 degrees because actually the foot is now bent down like this. It's hard to tell on this image right here, but the foot, instead of being at 90 degrees, here would be the foot, here would be the leg, instead of being at 90 degrees, it's actually bent down like this. And it's really tight to hold it down. And it's also turned inwards, as you can see very easily, with the bottoms of the foot, the plantar aspect of the foot facing each other. And so that's called a clubfoot. And the type of clubfoot is it's a Talpy's Equinovaris. Equino means the feet are pointed downwards. Varus means that the plantar aspect is pointed inwards. Okay, and sometimes these even have to be surgically corrected. If the kid is allowed to stay with this, if the infant or the newborn is allowed to stay with this, basically they'll be non-ambulatory. They'll be walking on the side of their foot their entire life. You might see somebody who's like walking on the side of their foot. Basically, what it was a clubfoot that wasn't treated as a kid. Okay, and that's what that is. So that's a little bit about a foot. So anyway, what I did here is just a little bit of a summary of some of the sort of more fun things that we'd see, in the musculoskeletal system. And there, I could go on and on. We could probably talk for hours about things like arthritis and stuff, which we may talk a little bit about in the next section in regards to joints, okay? But how arthritis will affect the bone, because it does affect the bone, and a number of other things that may happen to the bone. But I think this is enough. It's sort of like a little fun thing to do. There's some words in there that I think are really important for you to understand. But that's what I just thought it would be nice to have another 30 minutes or so just talking about some fun stuff in regards to the skeletal system. So hopefully that was enjoyable to you. Watch it again, share it with your friends and neighbors. They might like it as well. I don't know. But anyway, in the meantime, next video we'll put up will probably be involving the joints, and we'll go from there. Okay? We'll talk to you later. Be safe, be healthy.